Good afternoon and welcome everybody to our webinar, Air Pollution and COVID-19. I'm Barbara Gottlieb. I'm with Physicians for Social Responsibility, and I am just delighted to be introducing and welcoming you to a special webinar, which is a joint presentation between PSR, Physicians for Social Responsibility, and the Alliance of Nurses for Healthy Environments. Today, we're celebrating the publication of our two reports, one from each of our organizations, on the question of air pollution and possible connections to COVID-19. Each of our organizations did produce a report. We will put the links to those reports in the chat section, and I strongly urge you to look them up and read them after our presentation is over. We do have a very full presentation today, so I'm going to get moving. Just one word about Physicians for Social Responsibility. We are a national organization of physicians as well as other health professionals and concerned residents around the country, working to address the greatest threats to human health and survival. And certainly climate change is one of those, which is why we are looking at air pollution from fracking. Katie, would you introduce ANHE for us?
Sure, thanks, Barb. And I'm so excited to have so many people joining us today. If you don't know about the Alliance of Nurses for Healthy Environments, or as we like to call it affectionately, ANHE, we're the only national nursing organization whose main focus is on the intersection of health and the environment. And we work with nurses and nursing organizations around the country and the world on a variety of environmental health topics, including climate change, clean air and clean water, and hospital sustainability. And we are really excited to share our report, Nurses on the Front Lines, Unmasking the Influence of Air Pollution, Health Disparities, and Oil and Gas Development on COVID-19, in which we examined the implications of the oil and gas industry and air pollution on communities in Colorado, Montana, and New Mexico in the time of COVID-19. Additionally, in our report, we highlighted the stories of nurses in each state as they shared their experiences and insights on the intersection of the pandemic, air pollution, and oil and gas operations. And you'll be hearing more about these stories today. So I can't wait to hear from all these authors. With that, I'll turn it back to Barb for some introductions.
Okay, actually, let me just say one more word about the PSR report. The PSR report is a little bit different from the ANHE report. We were looking specifically at the states of Colorado and New Mexico and looking to see what the data told us about where pollution from fracking was intense and whether or not there was a correlation between that and the number of cases of COVID-19 in those two states, and correspondingly the number of COVID-related deaths. So we do have, each of us has two co-authors who are presenting today about our reports, and I'll introduce the two speakers who are the co-authors of the report for Physicians for Social Responsibility. So the first is Dr. Edward or Ned Katire, MD. Dr. Katire is a pediatrician based in the Pittsburgh area. He earned his BS from the University of Vermont and a medical degree from Northwestern University Medical School and completed his residency at Children's Hospital of Pittsburgh. As one of the founding physicians of the Pediatric Alliance, PC, Dr. Katire served as its president from 1997 to 2004. He worked at the Pediatric Alliance since 1990, and he's the editor of the popular pediatric blog, the Pedia blog, which you should all be following if you're not already. He's also a member of the American Academy of Pediatrics Council on Environmental Health, the medical advisor to the Southwest Pennsylvania Environmental Health Project, a real expert area on fracking, and I'm proud to say board president of Physicians for Social Responsibility, Pennsylvania. Our other speaker on behalf of the PSR report is Dr. Lisa McKenzie, PhD, MPH. Dr. McKenzie is a clinical assistant professor at the University of Colorado in Denver at their Anschutz Medical Campus, and she holds degrees from the Colorado School of Public Health, University of Colorado, and the University of Montana. Dr. McKenzie is a widely published researcher on topics related to the health effects of unconventional oil and natural gas extraction, which we commonly abbreviate as fracking. Her research spans many years and a range of topics, just a few of which are congenital heart defects and intensity of oil and gas well site activities in early pregnancy, relationships between indicators of cardiovascular disease and intensity of oil and natural gas activity in northeastern Colorado, and environmental justice in unconventional oil and natural gas drilling and production, all of which you'll see the relevance of when you hear from Dr. McKenzie. So Katie, could you introduce your speakers, please?
Great, thanks, Barb. And so we have two of our report authors here today. I just also wanted to say thank you to Dr. Azita Amiri, who was one of the other co-authors. It was a really awesome group effort working on this report together. First, we'll be hearing from Dr. Ruth Mcdermott Levy, who's an associate professor at Villanova University's M. Louise Fitzpatrick College of Nursing, and is the co-director of the Mid-Atlantic Center for Children's Health and the Environment. She's worked with families living in fracking communities of northeastern Pennsylvania to study, educate, and reduce environmental health risks. She's recognized as an expert in environmental health nursing education and has authored several publications regarding implementing environmental and climate health into the nursing curricula and the health impacts of fracking. Kara Cook is the Director of Programs for the Alliance of Nurses for Healthy Environments. Her work with ANHE focuses on engaging nursing organizations and individual nurses in environmental health advocacy, education, and practice change. And with that, we can hear from our first speaker, Ruth Mcdermott Levy.
Okay, there you go. Okay. Thank you, Katie. And I'm trying to, there, you should be able to see this. There you go. Okay. I was asked to talk about air quality and kind of how that influences health. So I'm going to do that and then add our the part of our report where we looked at the literature related to COVID-19 and air quality, and then also make the link with air quality and fracking. So really quickly, we have the criteria air pollutants that are set by the EPA. The two at the top here are the ground level ozone and PM 2.5, which is the fine particulate matter. And these are the ones that are most studied. And so that's why I have them highlighted. And they're the ones that we're going to be talking about the most today, actually. So this photograph is from the Denver Post, showing the ground level ozone that is surrounding Denver related to oil and gas development in the region. And ground level ozone is a very potent pulmonary irritant. And so if you have pulmonary disease to begin with, it can be a problem, but it also can be a problem for healthy lungs. And so people who don't have pulmonary disease can feel tired, short of breath in the presence of ground level ozone. This air pollutant occurs from secondary pollutants of volatile organic compounds that we will be talking about, and nitrogen dioxide. And there's a photochemical response. So when in the presence of sunlight, we have a lot of ground level ozone. And so again, this is what it looks like, and you can see it in cities around the country and in other regions as well. With particulate matter, these are very, very small particles for PM 2.5. So we're talking about 2.5 microns, excuse me, that are very tiny and are so small that they can actually float and travel quite a distance. And so when we think about those particles and also the moisture, that because they are so small, they can actually get into our lung passages, get down into the alveoli, and actually there's risk that they can cross the capillary into the capillary beds and go throughout the organs of the body. So PM 2.5 is a very important air pollutant. And this slide, which I'm sure many of you have seen before, this gray tube here is actually the size of human hair. So it kind of shows how very small this is. Air pollution affects all of us. Often we talk about the impact on older adults because they have many comorbidities. But we see the risk also with pregnant women and its influence on the developing fetus. Pregnant women breathe more deeply, and so when they're in the presence of air pollution, it can be a greater problem because they're bringing in more pollutants. And there is a relationship between air pollution and fetal development, low birth weight children, and also risk of stillborn. The other thing that's really important when you're thinking about air quality across the life cycle and air pollution across the life cycle is the impact that our lungs do not fully develop until the 3rd decade of life. And so that is for someone in their 20s, and you think about the activity of a young adult and things that they may be exposed to. So the reason I'm telling you this is that we worry, as I said, we worry about older adults and adults that may have existing lung disease, but we want to also think about the overall impact of the community, again, throughout the life cycle. So as this slide shows, of the poor pregnancy outcomes that come overall with air pollution, but we also see, again, in adults, worsening or exacerbation of chronic illness, such as diabetes, cardiovascular disease, and respiratory diseases. This list is the list of people that are at risk for severe COVID-19 or greater mortality from COVID-19. And so when people live in an area of high air pollution, they have these risks anyway, and then we've coupled it with a very infectious virus. And so the studies that we found in our report, so we did an initial review of the literature, and we found in an Italian study that there was a relationship between a variety of air pollutants. You can see PM2.5, PM10, which is larger particles, nitrous dioxide, carbon dioxide, and ozone all had a greater incidence of COVID-19 infection. And these studies were done with controlling for population density. So even in urban settings where people are close together, there was a greater risk. The study in the United States that got a lot of attention was out of Harvard School of Public Health. Dr. Wu and colleagues found that PM2.5 increased the severity of the disease and greater mortality. As we move along and look at more studies related to COVID-19 and air quality, we also see the influence of the social determinants of health, where there's racial disparities of non-white males that didn't achieve high school education, testing positive more frequently than other groups of people. And then also with the Black population. And we've heard the risks for the Black community and how in densely populated communities with poor air quality, they had 2 times the risk of COVID-19 cases. And we are also aware of the mortality related to that. So that brings us to oil and gas development. And what we see with oil and gas development is not only at the well site, but truly throughout the entire pipeline. So from the time the well is started through bringing it to marketplace, there are areas where there's higher carbon dioxide, methane, hydrocarbons, particulate matter, ozone, nitrous oxide, sulfur dioxide, and silica. And there are studies also to support the influence of fine particulate matter around drilling and fracking operations, emissions near the waste pits of fracking with higher VOCs, and then also more asthma and respiratory disease. And there's also evidence to show that there's impact on the developing fetus and birth outcomes. So all of these coupled together with the greater risk for communities within the gas fields. So thank you very much, and I will take questions later. And our next presenter is Dr. Lisa McKenzie, and she will be talking about oil and gas impacts on COVID in Colorado and New Mexico.
Thank you, Ruth. And I'm just going to pull up my slides here. Hey, good afternoon, everyone. And I'm going to be following up with the information that Ruth gave us. And as she explained, oil and natural gas development is a source of air pollution, and it emits pollutants like particulate matter from all the engines and things that are used to produce the oil and gas. And it also directly emits things like the volatile organic compounds that are precursors to ground level ozone formation. Additionally, it also directly emits benzene and other toxic or hazardous air pollutants. So since we already knew this and there's a good body of literature supporting this, the question we want to know was, would we see anything in COVID incidents and COVID mortality in Colorado and New Mexico counties that had a lot of active oil and gas production going on? And we want to know if there was more COVID incidents and mortality in those counties than we would expect in the state. And the result of this work would be so we could generate hypotheses for additional studies. So what we did is we selected 5 counties in Colorado and 5 in New Mexico. And these counties included the 3 top producing oil and gas producing counties in the state. And they also included the major oil and gas production basins in each state. And then for each county, we used a standardized ratio method so we could calculate the expected number of COVID cases and COVID deaths based on state rates and compare them to what we were observing in the county. And because we already know that COVID varies, the COVID incidence and mortality will vary by age and race or ethnicity, we adjusted our estimates by both age and ethnicity or rate and age, race, and ethnicity, excuse me. So, and we did our poll of the data for COVID cases and deaths on October 12th. So we used information that was available at that time. We got our COVID information from US Facts, and we got our population, the state information population from Colorado and New Mexico sites. And what we found was that in Colorado, and we're first going to be looking at the expected cases of COVID here, the blue bars are showing what we observed in the counties. The orange bars show what we would have expected based on state rates. The gray bars are showing the age adjustment, after we adjust for age, what we would have expected. And the yellow bars are showing what we would expect after we adjust for age and ethnicity. And what you can see here in Colorado is that in Adams County, in Garfield County, and in Weld County, we observed more cases of COVID than we would have expected. And even after we adjusted for the race proportions and age proportions in those counties. And I can tell you in Colorado that Weld and Adams County are in our Denver-Julesburg Basin, which is our major oil producing basin in the state. And Garfield County is in our the Piceance Basin, which is our second largest producing basin in the state. Now, I also want to point out, though, that in Broomfield and La Plata counties, where we had overall fewer, smaller populations, we saw fewer COVID cases than we would have expected. Looking at New Mexico, we also in Eddy County, Lee County, and San Juan County, we're once again seeing more observed cases of COVID as of October 12th, 2020 than we would have expected. In the 2 other counties, we see we observed fewer than we would have expected. And this is the trend continues even after adjusting for race and age. One thing I do want to point out here on this slide is San Juan County, how big of a change this adjustment for race made in the expected number of cases. San Juan County has a very large Native American population, and we know that COVID hit the Native American population especially hard. Okay, looking at the same numbers for COVID deaths. This is Colorado first, same color coding here. We observed more than expected deaths in Adams County and Broomfield County and Weld County. Looking at New Mexico, we saw, and I want to point out for New Mexico, for deaths, we did not have the state data we needed to make the adjustments for race and ethnicity. And this is a big limitation here, so keep that in mind. And where we saw more than expected deaths was in San Juan County. And so while we did observe this, I just want to point out that, as I said on the previous slide, that this is a very large Native American population, and not being able to adjust for that really makes this result very unreliable. So based on these results, it's not clear whether oil and natural gas operations are affecting COVID transmission, morbidity, and mortality in Colorado and New Mexico. That being said, the evidence is emerging that air pollution increases the risk of getting a respiratory virus like COVID and of experiencing a bad outcome, such as a hospitalization or death. It still would be recommended to reduce air pollutants from oil and gas pollution, oil and gas development, because they are contributing to the overall air pollution. And to really understand if oil and gas itself, the air pollution from oil and gas, is making a contribution to COVID, we need to be able to do studies where we can really look at individual data. And thank you for your attention. And I will now turn it over to Dr. Katter.
Thank you very much, Lisa.
I need to go back. Sorry, I'm trying to get back over so I can stop sharing my screen. There we go.
Very good. Hello, everybody. It's nice to be with everyone today. So I'm going to be talking about health disparities and fracking. We know a lot about fracking here in southwestern Pennsylvania. And we know that health-harming pollution is expelled at every point of shale oil and gas operations, from the wellhead and beyond, through the pipelines and the compressor stations, to processing facilities and refineries, export facilities, and cracker plants that make one thing nature doesn't need any more of, which is more single-use plastic. The health risks to people living nearby are very real and very serious. The 7th edition of the Fracking Science Compendium was published recently by PSR and Concerned Health Professionals of New York. The compendium is an essential document, a fully referenced, up-to-the-minute compilation of the evidence outlining the risks and harms of fracking, collected from more than 2,000 peer-reviewed medical and scientific papers, investigations by journalists, and government reports. The evidence-based science tells us that fracking has grave health, environmental justice, and climate impacts. Especially where I live and work in Washington County, Pennsylvania, which is the most heavily fracked county in the Marcellus Shale region, we see with our own eyes that fracking scars the landscape and damages and degrades the environment. It pollutes the air, the water, and the soil that all of us depend on. It accelerates climate change. And fracking waste and pollution, along with all the stress it causes, makes people sick. Like previous editions, this 7th edition of the compendium finds no evidence that fracking can operate without threatening public health directly or without imperiling climate stability, upon which public health depends. By the way, there's no peer-reviewed studies, zero, demonstrating that fracking is safe, because it isn't. Fracking is inherently dirty and dangerous, and industry rules and government regulations can't fix that fact. We also can't seem to fix the longstanding and systemic racial and economic biases that are revealed when the oil and gas industry and government regulators come to town and place oil and gas infrastructure adjacent to poor, underserved, and marginalized communities. It is in these same disadvantaged communities where we have seen increased morbidity and mortality from COVID-19. During the pandemic, we've learned that chronic exposure to air pollution and high rates of COVID-19 occur in tandem and disproportionately affect Black people, Native Americans, and Latinx people. We state in our report that oil and gas production sites are a major contributor to air pollution, and emerging studies indicate that exposure to air pollution is associated with increased morbidity and mortality from COVID-19. Indeed, we found in heavily fracked counties in Colorado that the number of cases of COVID-19 was disproportionately high among Hispanics. In New Mexico's oil and gas patches, disproportionately high levels of cases were observed among Native Americans. So during the pandemic, we've been hearing that we're all in this together. But is that really true? The disparities in morbidity and mortality that we see in people affected by COVID-19 and in people affected by fracking tell us that we may all be in this together, but we're not all in this together equally. The science tells us that fracking is an environmental justice crisis with injuries not borne equally by all. The same is true of COVID-19, where the oldest, the poorest, and the sickest suffer the most. In multiple regions where fracking is practiced, well pads and associated infrastructure are disproportionately sited in non-white, indigenous, or low-income communities. It is here, in these environmental justice zones, where health disparities are most apparent. Fracking is also more likely to adversely affect women. Multiple studies from various oil and gas patches in the United States and in Canada consistently link fracking to increases in crime that disproportionately harms women, especially violent crimes, including aggravated and sexual assault and sex trafficking. In fact, violence against women, especially in rural and indigenous communities, appears to be a feature and not a bug of oil and gas development everywhere on the planet. It shouldn't surprise anyone that women and children would be the most vulnerable and the most damaged members of communities dealing with environmental degradation and pollution resulting from fracking. Multiple studies now show that living near fracking sites can complicate pregnancies. Maternal exposure before and during gestation have been shown to result in poor birth outcomes like prematurity, low birth weight, small for gestational age newborns, and birth defects. All of these have lifelong consequences for children and their families. Health disparities from fracking are seen in other community members, the same people who are being hit the hardest from COVID-19 and the ones who will feel the impacts of climate change the most. Older people and those with limited financial resources are at risk, as are Black, Indigenous, and other people of color, as I've mentioned, who often live in environmental justice zones close to polluting industries like the oil and gas and petrochemical industries. Residents who have existing medical conditions like chronic lung disease, asthma, heart disease, kidney disease, mental illness, and those who are being treated for cancer and medically fragile children are at higher risk for having exacerbations of those diseases when exposed to the stress and the pollution from fracking. The situation is worse when people have limited access to quality health care, or if they're uninsured or underinsured, if they live in food deserts without access to healthy ingredients for a nutritious diet that support health rather than injures it, if they are overcome with stress from the noise and the odors and the light from nonstop drilling and fracking operations, and from the higher crime rates and violence we were just talking about in areas with few doctors, pharmacies, social services, and police. Workers in the oil and gas fields are also at risk. Fracking jobs are some of the most dangerous jobs in America. Industry workers who are exposed to physical injury, air pollution, chemicals, and radiation may not have the personal protective equipment or training necessary to protect themselves and their families from harm. And finally, we shouldn't forget our first responders. In the United States, the oil and gas industry is not legally required to disclose the identity of all the chemicals used in fracking operations. This secrecy puts first responders at a disadvantage when called upon to respond to an emergency, and it puts their health and their safety in danger. So I'm going to stop here and I'm going to turn it over to Kara.
Thank you so much. So I'm going to try to share my screen here. All right. Thank you, everyone. It's so great to be here with you all today. And I'm just going to share a little bit about the part of the ANHE report that I helped to work on specifically. And one of the things that we wanted to do with this report is, as we were seeing the role of nurses in the pandemic response really being highlighted on a global level, we wanted to talk with nurses to hear their experiences about living in community near or in communities where there's heavy oil and gas operations, and to hear more about what they were seeing on the front lines relating to this intersection of air pollution, COVID-19, and oil and gas, and really start to see some of the human impacts, the human component of the data and the statistics that we were finding in the report. And so for the report, I interviewed 3 nurses from Colorado, Montana, and New Mexico. And over the next few slides, I'm just going to give a quick overview of some of the stories that they shared with me. So the first nurse I interviewed was Dr. Darcy Martinez, who is a family nurse practitioner living in Commerce City, Colorado. And Commerce City is located in Adams County, and it's home to just over 900 oil and gas facilities. And Darcy shared with me that one of the biggest concerns relating to air pollution where she lives is the local refinery. And Commerce City is home to the Suncor refinery, which if anyone is in that area, you probably know this refinery very well. It's considered one of the state's largest polluters, emitting more than 800,000 tons of hazardous air pollutants a year. And it's been found to be in violation of state and federal air pollution standards a number of times. In addition to the kind of existing air pollution that this area struggles with, in 2020, when I interviewed Darcy, Colorado had just experienced its largest wildfire in the state's history. And what really stood out the most to me when I was talking with Darcy was kind of this impact of, community already struggling with air pollution. And then you add in the COVID-19 pandemic and the respiratory issues relating to that. And then the health impacts of exposure to wildfire smoke. And it was just, this really deadly and unhealthy combination. Darcy also shared an experience with me that really solidified this intersection. In the summer of 2020, she took a role as a temporary school nurse at a local city or a local school in Commerce City. And her role is to help assist the school in preparing to reopen in the fall of 2020. And just to give you an idea of kind of where the school sits in proximity to the refinery, it's located less than a mile from the refinery, and it's also located near 2 major highways. So that kind of gives you an idea of what they're dealing with air pollution wise. She also mentioned to me that many of the students in the school have chronic health conditions such as asthma and obesity, putting them already at a higher risk of complications if they contract COVID-19. So it was really important that the school had good measures in place to be protecting the students and reducing the risk of COVID-19 transmission. And so one of the recommendations that was provided to the school was to increase building ventilation as a method to reduce transmission risk. And so they had a local HVAC company come in to provide, those recommendations on how they could do this. And what the company ultimately determined is that it was unsafe to do so because of the amount of volatile organic compounds in the air surrounding the school. So if they were actually to increase the building ventilation, it would increase the hazardous air pollutants in the school. And so that risk of harm was way outweighed the potential benefits of reducing transmission risk. And so they were not able to do that intervention. And it was incredibly alarming that a school had to make these decisions, although likely not a unique story in communities that are plagued with environmental pollution. The second nurse I spoke with was Theresa Wicks, who is a nursing professor specializing in women's health and living in Billings, Montana. In Billings, Montana, Theresa mentioned there's 2 refineries located relatively close to where she lives. And she mentioned one of the communities that is near one of the major refinery sites sits in an area that's a lower income community, really directly surrounding the refinery. And residents often have concerns relating to air quality in the refinery's pollution. So this is a concern for the community. She wasn't directly seeing a correlation between COVID-19 risk and air pollution, but she was concerned about the potential interaction between these 2 components. And one of the biggest concerns she had was the combination of how air quality affects the immune system and the respiratory system, and the potential to affect Montana's aging population. And Montana is actually one of the oldest states, has the oldest population in the West. So this was a major concern for her as a healthcare provider. And at the time I was speaking with Theresa, Yellowstone County, where Billings is located, had some of the highest case counts in COVID deaths in the state. And the hospitals, in Billings and surrounding rural areas were approaching capacity. So again, this intersection becoming, a big concern in Billings. And then the last group of people I spoke with was Dr. Christine Casper, who is the Dean of the University of New Mexico College of Nursing, and then Dr. Catherine Zukowski, who is a toxicology and environmental science at the university. And they mentioned to me that from their experience, because the university works very closely with the public health officials in the state in the COVID-19 response, and they felt that the collaboration among public health officials and early decisions that were made by their elected officials really helped to kind of mitigate the COVID-19 rates and deaths in the state because of that adequate public health response. However, there were, and Dr. McKenzie mentioned this, there were some really hard hit areas of the state and areas that really struggled to control outbreaks, even, even though the state did have a pretty good response overall. And some of the hardest hit counties were in the northwest part of the state in the San Juan Basin. And over 20,000 oil and gas production facilities are located in these 4 northwest New Mexico counties that the San Juan Basin encompasses. And as Dr. McKenzie mentioned, the San Juan Basin also includes parts of the Navajo Nation, which experienced extremely high COVID-19 case rates and really struggled to control outbreaks. In addition to this area of the state also, struggling with pollution from heavy oil and gas industry, this area also has a toxic legacy of uranium mining. And so you have this heavy environmental pollution already on an area that is, struggling in terms of other health outcomes, and then you're adding on the pandemic as well. What Dean Casper shared with me is that there is a research group looking at the various environmental exposures and pre-existing conditions in COVID-19 risk. However, she really emphasized it was too early to tell what the potential intersection was. And it might take a long time for the science community to really understand those intersections, although they were seeing, concern for alarm and to be aware of the potential intersections of these areas. And overall, these anecdotal stories aren't meant to show causation, but really emphasize the intersection between air pollution from oil and gas, existing environmental pollution, and health disparities overall, and how these interact and affect health outcomes from the pandemic. And these stories really make a strong case for the need to ensure adequate protections for communities that are made vulnerable to adverse health outcomes because of environmental pollution. And I think that was kind of really emphasized in all of the presentations that went before me as well. And with that, I will turn it back over to Katie and Barb to facilitate Q&A.
Okay, well, thank you, Kara, and thank you to all of our really wonderful speakers, Ruth Mcdermott Levy, Lisa McKenzie, and Ed Katire, and Kara Cook. So we are going to open it up for question and answers. I actually forgot to announce at the beginning, and I apologize for this, that if you have a question, please add it to the Q&A section. You'll see that as one of the little icons at the bottom of your screen. And Katie and I will take turns reading off the questions, and then we'll just open them up for the speakers, and all of our speakers can just speak up and pile in. Katie, would you like to start with the first question?
Sure, thanks, Barb. So the first question is, I read that some oil and gas production was stopped in Colorado due to the pandemic. Might this have had an impact on your data?
Sure, I can take that question. Early in the pandemic, oil and gas production was very much slowed down in Colorado, almost to a stop the first couple months of the pandemic. It has since slowly come back online, and now it's a much closer to normal. We actually have active development and drill rigs in the state. So that there are many things that could have impacted our data, the results. First of all, less air pollution at the beginning of the pandemic from oil and gas. There was also less air pollution, if everyone will remember, from everything at the beginning of the pandemic. Planes weren't flying, cars weren't driving, so a lot of sources of air pollution were curtailed. I'll also add here the other thing that impacted this data, particularly in Colorado, was our wildfire season was particularly intense this year, and that would have been towards the end of August, September, and into October. We were having air pollution alerts from the wildfires in Denver, Colorado, and in the areas with our oil and gas development. So that's one of my points. It's really hard to tease out which source of air pollution might be associated with exacerbating COVID-19. But that takes a really carefully designed study to do that.
Thank you. I'll read the next question. It says, I live in Arizona and saw the devastation COVID had on the Navajo Nation. What are your thoughts on why this occurred, especially since the Navajo power plant was closed? Anybody like to try to take a shot at that one?
I guess I would say that Navajo Nation is underserved, and that's probably putting it mildly. I think access to healthcare is, from what I understand, is somewhat limited. I think that there may be inherent reasons of why Navajo Nation members got sick more frequently, perhaps even a genetic predisposition. I don't know if that's true or not, but that's something to consider. I don't know about the occupations that people work at, but that is certainly a risk factor when it comes to COVID. We know people who are essential, so-called essential workers, who are working in certain areas of the economy have higher exposures, or at least did. I think they still do, but certainly earlier in the pandemic. And I want to go back to that last question too. I think it's a mistake to really focus on well pads and drilling and fracking activity. If that is going down, yes, there is some pollution that's going to be lessened, but you're still running compressor stations, you're still running refineries and export facilities. You're still, taking some of that fracked gas and using it for other things, perhaps petrochemical production. Fracking is an industry that keeps on giving when it comes to air pollution, and it's not just at the well pad.
And if I can add to Ned's comments, actually both of them, the Navajo Nation also has comorbidities as a population, and one of them is diabetes. And so that is, a known risk factor for severe COVID-19. So, in addition to all the other issues that Ned mentioned, it's a group that has some significant comorbidities. And thinking about the air quality, yes, the well pads weren't working, weren't in full operation as Lisa and Ned described. But, if you have existing chronic air pollution, we have then people with lungs that are already irritated and inflamed. And so, Ned's comment of it keeps on giving, even when it slows down, it keeps on giving to the human organism.
And I would just add to all of that, and I think Kara had mentioned this, in the Navajo Nation, particularly in the San Juan Basin, there's legacy uranium mining, and that's been an environmental stressor there for quite a long time and impacted the health of people there. So that's an underlying environmental condition.
And I'd also just add to, in talking with some folks that were working with the Navajo Nation, there were many there who didn't have access to clean running water. And so, we were talking to everyone, you need to be washing your hands, but how can you do that if you don't have clean running water in your home? So, the multiple stressors that they were experiencing and are still experiencing. So the next question is concerning the data. And I know we struggled with this with our report, and I'm sure you had the same issue with your report with PSR, is looking how to access the air quality data. Like, are you able to get like real-time data, on PM 2.5 or ozone in those counties so that you can then see, overlay that with the morbidity and mortality related to COVID-19?
I'll take that one. I'll start with that one. That's kind of a tricky question, a conundrum. Yes, you can get PM 2.5 data and ozone data at the county level. Those are not the only air pollutants associated with oil and gas, and you can't get several of the other air pollutants associated with oil and gas. That's not being collected everywhere. Also looking at things at the county level and also looking at COVID at the county level, it's really a very high up look at it. It's, oil and gas development isn't distributed evenly over the county. There are parts of the county that have it and parts that don't. So by applying a blanket air pollution measurement to everyone, that's going to obscure your results, make it very difficult to see. And that county level particulate matter and ozone is coming from many sources within the state and county. It's not only oil and gas. So that makes it very limited for us to use. So that would be one way to answer this question, and others might have some other insight into this.
If we don't have other respondents to that question, we do have other questions stacking up, so I'll move us along. First, I just wanted to share a comment from one of our attendees in regard to the many things you said about the varied sources of impacts on the Navajo Nation and the cumulative effects. The person said, all excellent points. Thank you for your information and thoughts on the Navajo Nation. This is a population that is near and dear to me and I've worked with extensively. So thank you for your input. Here's another question. What is the reason for violent crimes, including rape, associated with oil and gas production?
Why are women always the targets for violence? You know, it's not just in oil and gas patches that this seems to happen. And it's not just in the United States and in Canada where this seems to happen. It's extremely ugly that this happens at all. You know, the people who come to work in oil and gas patches are very often not local people. They're coming from outside. They're mostly men, mostly younger men in an environment of other young men. And some of them live what they call man camps, where these are places where after a shift, they go and sleep, kind of like barracks. Some places here in Southwest Pennsylvania, there are hotels that put up the workers. They're coming from all over. There's a high rate of drug and alcohol abuse. That is certainly a contributor. It's just you know, there's no excuse for it happening, but this is something that happens. And like I said, it's not just, you know, in the Mountain West states or here in Southwest Pennsylvania, it's everywhere, and it's pretty terrible.
And one thing I'll just add, because Theresa in Billings, Montana mentioned this to me as well. So in the back-end development in North Dakota, which is very close to Billings, Montana, she said they had over the years since that development was really booming, and you know they had the active drilling, and that they were seeing the ripple effects of the sexual violence, you know, coming not just around that area where the oil and gas was, but it was actually impacting people in Billings, Montana. So it's a very big reality for communities near these operations.
Thank you to everyone who's been sending in all of these questions. These are great. So next question, can you speak to how these reports will be used and what are some next steps?
I wonder if I shouldn't speak to that. This is Barb Gottlieb from PSR. First of all, I'd like to tell you a little bit about how these reports have been used. After publishing our reports, we shared them with our members, especially in the target states, the states that were studied. And a number of our members have used these reports already to write letters to the editor, to write op-ed articles, both of which are really valuable ways of increasing awareness and education about these kinds of issues that may or may not be on people's minds. And then also we have asked them to send, we have asked our members to send these reports to their members of Congress. And let me turn the answer around to our audience and say how these reports are used is in part up to you. Let me mention that Congress is right now in recess. That means that your members of Congress are probably home in the district. It's a wonderful time to reach out to them. You can't visit them personally as you might have been able to in the past, but you certainly can through their websites. Tell them what you've learned from these reports. Tell them what you've learned on this wonderful webinar today, and send them the links, send them the links to the reports. They're now both posted in the chat. So how we use this material, this information, how often we use this information, how effectively we use this information. It's also in your hands, so please do. Anybody else want to jump in?
And I'll just add, in our report, we included recommendations for the new administration about what we felt was priority issues to work on relating to some of the findings in our report. Things like reopening the review of the particle matter standards and ozone pollution standards, as those were the review was conducted during the last administration and the old standard was kept the same, and we felt that the science did not support that. And so that was one of our big priority issues that we're looking for the new EPA, the new administration's EPA to relook at, as well as just making the case for climate action and reducing air pollution or reducing environmental pollution in these communities that are just being bombarded with pollution from a variety of sources. So we've shared our report with the transition, at the time, the transition team, and then with the new administration's confirmation appointments, as well as the new EPA administrator, and we'll continue to do that with our advocacy work.
Thank you. I think we have time for one more question. And this is one that I think will also turn back to the audience. It says, from Pittsburgh, PA, thank you for sharing with us your knowledge on the correlation of air quality and health effects. Unfortunately, we have had a difficult time with our county level health department to enforce regulations pertaining to air quality. Could anyone share any successes they may have had in dealing with local health departments? So I open that up to the panelists. Please jump in. And if anybody among our participants would like to answer, I would suggest that you raise your hand. And Julia, if I may ask you to unmute the people who raise their hands and call out their names, and then we'll see if we can bring them into the conversation. So who'd like to get us started? Any successes dealing with your local health departments?
Can I say something coming from Pittsburgh myself? Is that our local health department, the Allegheny County Health Department, has been actually successful in several aspects when it comes to childhood lead poisoning, lead in water lines, getting infants and toddlers tested as a mandatory step in well child care. That's a success. And they worked very hard at that, and I would give them credit for that. I think they're limited in some respect as far as some of the air quality issues. They're a little bit maddening in Pittsburgh when it comes to industrial pollution, and we're fighting them every step of the way. I'd say the same thing for the state health department. They've done very well in certain aspects, particularly the opioid crisis in Pennsylvania. They've done a great job with that. They've done a decent job, I would say, with COVID. But when it comes to fracking, they fall down and they can't get up. They fall on their faces, both the local Allegheny County and the state health department. It's crazy how they just can't, they can't do the right thing. They can't say the right thing. They just spout industry talking points as if, they're getting paid by the industry, which we'll leave that for another discussion. But it really, when it comes to fracking, for some reason, they don't get it.
And I don't know if we're waiting for anyone to speak, but I'm from a county in Pennsylvania where we've got pipelines coming through, and our health department hits it right back to federal. They're like, that's out of our jurisdiction. We don't worry about it. But I remind them that the residents aren't federal, they're county level. So yeah, no one wants to take responsibility. It's a challenge.
Well, it's time for us to wrap up. It's perhaps not the most positive note to end on, but I think what we can recognize is that this has been a wonderful webinar. We've all learned a tremendous amount, and it's by sharing this kind of information that we can move our county health departments, our local legislators, our senators, congresspeople, and the administration. So I think that's what we all have to do. We'll be sending a link to the recording of this webinar around to everybody who registered. Thank you so much for joining us. And thank you to our wonderful presenters. Dr. McKenzie had to jump off. She had another meeting a minute ago, so she's already left us. But thank you, Ruth Mcdermott Levy, Ned Katire, Kara Cook, and Katie Huffling. Thanks to all. Goodbye.